Hey everyone, in this video we're going to be covering the liver and the surfaces that are going to be on it, around it, in it. So let's dive right in. So number one, on your right side. So this is the right side, this is the left side. We're looking as if you're looking at somebody, if their head was up here, and here's their liver. Okay. Number one being on the right side, that's going to be the right lobe. Hopefully that's simple for you. Number two, it's going to be the left lobe. Number three is going to be the quadrate lobe. We'll cover that uh, here in a minute. But staying on this anterior view, five right there, that's going to be your coronary ligament. And we have the diaphragm sitting right above, draping over that liver right there. So if you can remember the central tendon of the heart, and you remember that central tendon sitting up there, if you can remember that connects into the diaphragm and you have this coronary ligament, that might help you. Number seven is going to be the falciform ligament. Number 16, this is going to be your ligamentum teres hepatis. This is also known as the round ligament. In a fetus, this is known as the umbilical vein. This will come back to haunt you in your lecture class if you do not go back and review that blood flow for the fetus, because they turn into ligaments. Number 9 is your gallbladder. So now we're going to take this liver and we're going to rotate it to where this backside is coming towards you. Okay, so it's like we're just rotating it, and that's where this is right here. We've just rotated it. So number 7 is now up here. We can see that. Ligamentum teres hepatis is right there. Here's number 3, that quadrate lobe, 4 sides like square. Number 4, that is going to be your caudate lobe. I guess you could say it's being coddled right there by the inferior vena cava. And this is where the hepatic veins are emptying, right here. Number 5, we already covered, that's coronary ligament. 6 is the bare area of the liver right here. So the reason we call it that is because it lacks peritoneum and is in direct contact with the diaphragm, if that answers any questions. Number 10, that is going to be your common bile duct. Number 11 is going to be your hepatic portal vein. And number 12 is going to be your proper hepatic artery. So that right there is what we call your portal triad. Um, this is the hilum of the liver. You might also hear it as porta hepatis. Really good test question right there. 13 is going to be the gastric impression, meaning the impression from your stomach is really making that. And that is going to be located underneath the left lobe, which makes sense, right? I mean, that's where that stomach is sitting, basically. So that gastric impression is number 13. 14 is going to be that renal impression. from the kidney. And 15 is going to be your colic impression. So this is coming from the colon. So avoid looking at this. Just picture it's not here. You're going to have that ascending colon coming up, and it makes that left-hand turn to make the transverse colon. That's where 15 is right there. That's going to be that colic impression. And 16 we already covered, ligamentum teres hepatis. So that's going to be it for this video. If you want to know a little bit more or want another resource to look at in the textbook, it's on pages 159 and 161. If the video helped, please like it, and we'll see you in the next one.
Alright, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nilsson and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.